looking at his MRI, one thing I like to do is always look at the images myself, because the amount of scar tissue, dehydrated tissue, actual areas where they have muscular problems really does affect the outcome and how long it takes for someone to repair.
It's a little frustrating that the only option that was provided for me, obviously, until I found him, was surgery. And these are supposed to be professionals. And, you know, it's not even the fact that I could sit with my, who was going to be my surgeon, and he's already letting me know before we even perform that I'm going to need more down the line.
After the last injection, his stretch and his range of motion is also improved, with being able to touch his toes now at a deeper angle without having any pain or discomfort. So just one injection so far, 2 more to go, but he's making great progress already. So today we're going to be using PRP with Mr. Lefroy. So PRP in a nutshell, if I took a knife and cut my arm, you'd see a lot of red blood cells come pouring out. Those red blood cells are like cars. They're driving healing cells to the site of the injury. That's why over that cut you'll have a scab formation, and underneath that scab you'll have tissue that's being regenerated and rebuilt. So when that scab falls away, you have nice clean tissue underneath. He's got a really significant disc herniation back there. So when we inject that PRP in that space from the L5 to S1 vertebrae, we're going to have that platelet be back there, activate, release a lot of growth factor. That growth factor is going to start to repair the tissue that's been damaged, such as muscles, tendons, ligaments, even the bone itself. That in combination with some of the techniques we're using, we're going to start to see that disc space that's already bulging out start to recede a little bit more.
So as a part of Kyle's treatment plan, we are using the Biogenetics Regenerative Support Kit. And what this is going to do is really help decrease those inflammatory markers in his body and help promote optimal healing so that we can address some of the pain and the limited range of motion that he's having. So what the biogenetics is going to do is really target the inflammatory processes that we're seeing in his body. By decreasing the inflammation, we'll then be able to take a more targeted approach, and some of our other medical interventions will really begin to work and really promote that healing that we're looking for in his body so that we can decrease his pain and really return him back to his baseline.
I would say my pain, when I probably first started coming to him, I would say my pain probably like a 5-6. I think my pain tolerance is a little different. But I don't know, I did feel like when I did have pain at that 5 or 6, I was kind of like out of commission during that time. So I needed to sit down, lay down, something to kind of let it calm down. Past 2 weeks, I've probably been at like a 1, 2. So like I don't even really, again, I'm not really doing any activities that's too crazy right now. They told me, you know, work my way into things slowly. But yeah, I mean, there are days I kind of forget about it. So I've had days where I felt so great I wanted to go, you know, work out again. But like I said, I'm just trying to take things slow, so.
So when we're looking at this gentleman, one of the things we need to do is we're looking to make sure that we can actually get the bulge receded back in, get some of the disc height in, and rehydrate it, and have no side effects, and use no medications. So one of the things we're going to be doing is using something called decompression just to open up the spine. We're going to use laser to end up helping some of the collagen tissues fasten back together and also decrease the inflammation in the tissue. And then something called PRP. The nurse practitioner or the medical doctor will be taking Kyle's own blood, spinning it for the plasma, and using the healing factors that are in the plasma. One example is that the amount of healing plasma factors we're able to inject in that area are multiple orders higher than the amount of healing factors that would be in the tissue on its own, even when it's trying to fix itself. So really, we're helping the body fix the body.
Me personally, you know, I have all the faith in Dr. Britton just getting me back on my feet, allowing me to get back on the court, and do something I'm passionate in, and just getting me back to, you know, honestly, I feel like better than I could have been if I went the surgery route. I feel like the future has unlimited possibilities.